Hi everyone, my name is Lauro Gonzalez and this is a tutorial for medical English. We are gonna I'm gonna present the presses we have I have made in all this first partial, and I'm about to present. Waiting for loading. Presentation. Well, here we are. The first of all, I'm gonna about to talk about danazol treatment for telomere disease. First of all, we have to talk about the definition. Telomeres are regions found in the nucleotide sequence. Telomere disease refers to genetic defects in their maintenance and repair, causing bone marrow failure, liver cirrhosis, pulmonary fibrosis, and they increase susceptibility to cancer. In a study, they test the use of danazol and androgen as a treatment, on base that these hormones have been used to treat bone marrow failure. The study results in a 30% improvement in telomeres attrition after 2 years of danazol treatment. Application in medicine, danazol has an effective treatment for telomere disease. Doctor can now use these or other hormones, particularly sexual hormones, to treat the disease. This finding has also opened doors to further studies on danazol and other sex hormones as treatments for other telomere-related diseases. The pros, danazol is effective, leading to think that other hormones can help. Patients have a good response toward the pharmacologist's intervention. Lower doses can prevent secondary effects. Cons: the use of danazol is relatively new, so it can take time till it fully accepts its use. Danazol still require further studies to assess the effects of treatment on survival or progression to myelodysplastic syndrome and acute myeloid leukemia. Here in Ecuador, there isn't much information about this disease, but as it's congenital, it isn't known cause the genetic defects in the telomeres, so any child could have it. As a conclusion, danazol treatment for telomere disease is still recent, but possesses a good prognosis for this disease. With further investigations, a good prognosis for telomere alterations and bone marrow disease. On a downside, it is known how much time will it take for Ecuador to have this treatment once it's fully studied and approved. Okay. We're going to continue to the next presentation. Slowly. Now we're going to talk about acute appendicitis. As a definition, is an inflammation of the inner lining of the vermiform appendix that spreads into other parts. It doesn't have any application, any pros for medicine. As a non-application, it don't have any relevance in medicine. It don't have any pros, and as a cons, the inflammation of it will result in some several diseases that will put the life of the patient in danger. As a disease, They have to be a surgical emergency. We can see peritonitis and sepsis. There's a video. So we can conclude that the acute appendicitis is a very dangerous situation, and it have to be treated as soon as possible. Now we're going to continue to femoral artery, and let's wait until it loads. Now we are here, femoral artery. As a definition, is a large artery in the thigh. It is a continuation of the external iliac artery and begins at the inguinal ligament, femoral head. This is a short video. Application in medicine, it provides blood to the thigh, provide blood to the arteries that circulate the knees and the foot, and also enters the adductor canal. It provides blood to the thigh, as I have said, the circulation of the knee and the foot. As a pros, it provides blood to the lower level of the body. As a cons, is susceptible to peripheral arterial disease. These diseases can be the peripheral arterial disease, arteriosclerosis, and popliteal aneurysm. There it is. Now we're going to talk about the yeah, we're about to talk about three different type of medical issues or medicine to treat the diabetic retinopathy. As a definition, what is diabetic retinopathy? Is an accumulation of fluid in the macula, part of the retina, that control our most detailed vision abilities due to the leaking blood vessels in order to develop diabetic retinopathy. The method at 89 clinical sites, they randomly assigned 660 adults with diabetic macular edema involving the macular center to receive intravitreal aflibercept at dose of 2.0 milligrams, bevacizumab at dose of 1.25 milligrams. The results from baseline to 1 year, the mean visual acuity letter score higher than score indicating better visual acuities. They improve in 13.3 with aflibercept, 9.7 with bevacizumab, and 11.2 with ranibizumab. Although the improvement has greater with aflibercept than with two other drugs, it was not clinically meaningful because the difference has driven in by the eyes with worse visual acuity at baseline. Conclusion: The three drugs improve the vision in eyes with center-involved diabetic macular edema, but the relative effects depend on baseline visual acuity. When the initial visual acuity loss was met, there were no apparent difference on average among study groups. Now we have atrial fibrillation. The atrial fibrillation is a disorder of the rhythm of the heart. It results from disorganized electrical activities in the atria of the heart, which cause rapid stimulation of the ventricles, leading to an irregular pulse rate. It is the most common type of this arrhythmia. The classification, we have a basic classification. The one is the paroxysmal, that the patient gets repeated short episodes of chest palpitation that resolve spontaneously. In between these episodes, the heart is normal. Then we have the persistence, that does not resolve spontaneously but resolves after treatment, and the permanent, that persists or recur despite treatment. It usually occurs in patients who already have a diseased heart. The most common risk factors, we have coronary artery disease, including heart attack, disease of the heart valves, especially rheumatic heart disease, congenital heart diseases, sick sinus syndrome, hyperthyroidism, high blood pressure, cardiomyopathy, chest infection, pulmonary embolism, pericarditis, alcohol, and also we have tobacco. Signs and symptoms of the atrial fibrillation. Often, atrial fibrillation causes no symptom and is discovered incidentally during a physical examination. On the other hand, some patients may experience the following: palpitations, discreet blood pressure, shortness of breath, lightheadedness, confusion, and weakness. The diagnosis, if the history and examination is suggesting an atrial fibrillation, an electrocardiogram may be done to confirm the diagnosis. Blood tests may be need to check for thyroid and electrolyte problems, both that can cause the atrial fibrillation. Echocardiogram can be needed, also a Holter monitor, an event recorder, and a chest X-ray can be used. Lifetime need to change. Eat healthy food, use less salt, which helps lower smoking cessation, exercise, limit alcohol intake, reduce stress as a medication, anticoagulant, antiarrhythmic drugs, and cardioversion to maintain the normal heart rhythm and reduce the risk of relapse. With this, I finish my presentation. Hope you like it and see you next time.